hopefully it'd be helpful to just overview the Family Intervention Service and where we are and what we're doing. Yeah. So just to overview the service, obviously what we look at is that real holistic whole family approach in response to those complex presenting needs. So we're a real complex needs service. The work in the Family Intervention Service is delivered across 4 core strands of offer. Our casework element, which most of you will be aware of, which is where we receive those requests through the family front door on early help assessments. We ensure that those are effectively triaged and moved over. We also receive them through our step up and step down process within our internal teams within children's social care. And we really focus on using relationship-based and solution-focused intervention as part of that casework. That would be the part that most of you are most aware of. But what we also have is a duty service. So all of our family intervention workers across the county who hold those cases also spend up to 20% of their working time every week on duty. Our duty service isn't the same as other children's social care teams. It's a county-wide service for all of our children's social care teams for edge of care work, de-escalation and crisis intervention. And that service runs until 10 p.m. every day, Monday to Sunday, and overnight on Fridays, Saturdays, Sundays and Mondays. So there's a lot of out of hours work that our intervention workers are completing alongside their casework. So some of you that might have children open to the Family Intervention Service might try and contact a worker and they'll say they're on duty. That's what it means. They're out and about across the whole county doing work for children and young people and their families at crisis. We also have our Preventing Missing and Exploitation team, which we call PMEX. So the Family Intervention Service has the statutory responsibility for offering return home interviews to every child that goes missing who's aged 8 and over. So every single time a child goes missing, once the police find them, there's a responsibility to offer them a return home interview as part of the Safe and Well check. And the Family Intervention Service provides that service for children in Somerset. And we also do a range of direct work with children and young people at risk of exploitation, preventing them hopefully from reaching that statutory crisis level. As well as that, the 4th strand of our offer is our young carer offer, and we're responsible as a service for the statutory assessments of most young carers in Somerset. So that means offering them an annual assessment, signposting them to services, but also offering complex interventions if those needs are significantly higher. I will talk a little bit more about that as I move through the slides. So the objectives for our service are fundamentally to prevent the need for children and families to require acute services, so to require those statutory children's social care services. The reason for that is because we know that children's needs are best met at the lowest possible level, and we also know the impact on outcomes and into adulthood for children that experience statutory services or become looked after. So we're all about that preventative work. We want to reduce children and breaking down their family home, but being at risk of breaking down their homes with their families, within their communities, within their networks. We have a big focus on reducing further missing episodes when we've had missing episodes, and we also look at offering that young carer work, and mediation and stabilisation is a big part of what they do, working in partnership with families, children and young people to ensure that they feel safe and are doing their best fundamentally. Our casework intervention is about really specific intervention, about added value. So it's not to say that we're the right service for every family with a complex need. We need to be really clear that in the context of a multi-agency approach, we're going to be there to make a difference for families, not just hold them just in case. I'm sure many of you are aware of the broad spectrum of work that we do around parenting, behaviour, looking at emotional regulation work, delivering parenting programmes one-to-one where appropriate, looking at safety planning and risk assessments, and ensuring that we're following the assess, plan, do, review process within the context of working with our partners. So it's just being really clear that if you think the Family Intervention Service needs to come alongside the families and children, young people you're aware of, what is the added value? What is the purpose of us becoming involved? And what are the outcomes that we would be looking to achieve? So Family Intervention Service duty works across all of our children's social care teams. So it's an internal service only that can only be requested by local authority workers within children's services. So we work with our EDT colleagues, social workers across all teams, our children with disabilities colleagues, and the Family Intervention Service itself. And we're all about responding to emergencies and crisis for children over 10. We want to stabilise and intervene at the point of crisis to reduce risk and need, prevent children coming into emergency care, find solutions and stabilisation, and do a lot of mediation work to help families stabilise and meet their own needs fundamentally, and not rely on professionals to do that, but also prevent them escalating to those statutory acute level services. Our young carers, as I mentioned, is all around that statutory assessment. Fundamentally, the annual reviews, the core responsibility for us is our year 7 and upwards children and young people, because what we recognise is that young children in primary school who might have a caring role or responsibility, is more likely there's a safeguarding risk attached to that. So they might be offered a CNF assessment if they consent to that. But we also do signposting in and out of our respite groups and activities, working alongside those families and meeting their need at the right level at the right time. So they might have some lower level intervention from us and signposting to groups, but if things start to change or escalate, we'll offer a new assessment or offer a complex level intervention. It's really important to also highlight, any of you from education, that currently there's someone called Mel Bicknell, commissioned by the local authority, who's doing a Young Carers in Schools project with Youth Unlimited. And any of you that don't know about Mel Bicknell, I'd really encourage you to go onto the Youth Unlimited website and look at what your schools can do to really promote the support and provision for young carers and identification of young carers. And Mel Bicknell's really good at coming alongside and supporting with that. Fundamentally, it's all about appropriate identification and safeguarding of children with caring responsibilities. The PMEX team, as I mentioned, the MISPA team do those return home interviews for every child who's reported missing and found, that we make contact with every child, preferably within 72 hours of being notified that they've had a safe and well check. So the police are responsible for an initial safe and well check. And then once we know the children are back home, we have 72 hours to make that initial contact, offer them an interview, and try to understand what the triggers might have been, what we can do to prevent future missing episodes, and check that the right professionals are involved with those children and young people. The PMEX team do a slightly different type of casework. They do a more intense casework with a lower caseload to really try and prevent that escalation around county lines, criminal and sexual exploitation, and really looking at those early stages and early identification to reduce the escalation and protect children from becoming significantly involved in exploitation. A big part of that work is the intelligence gathering, working with our colleagues in children's social care to ensure that, you know, the support is there. I'm just going to scan through before I move on to some of these questions so that I don't lose any of them. Can we have the contact number? So Anna, all of our contact for the Family Intervention Service comes through Somerset Direct. So because they're a all-day service with call handlers available. So if you call in with a specific query, they will signpost you to the right person. So if it's about a specific child, they'll be able to look them up and see who might be dealing with it. If it's about a specific area, they'll be able to find you the right manager who's on duty or available. So all contact for the Family Intervention Service will come through the front door through Somerset Direct. If a family, Danielle, if a family's allocated worker is on duty, they will have a safety plan and agreement with that family. So their families will know when they're available and not available. There'll be a safety plan agreed so that families know who they can contact. Occasionally, it might be another worker that they've met or the worker's line manager, but also they will know what the contingency plan is around that multi-agency offer and everybody working together. If you need to get hold of a worker and they don't respond and it can't wait until they're available, then again, coming through Somerset Direct, they'll be able to find you the right person at any given moment or any given time within the service, within the right area. Will the time frame for families being allocated improve? We're finding their waiting ages and going into crisis, and that is a significant challenge for us. We have got a really high level of demand into the service. We are not a statutory service and we're not crisis or emergency service, so we have the capacity to hold a waiting list. There are times where that wait can be up to 12 weeks at times because of the demand on service and the needs of families. Fundamentally, there should have been a recent improvement because we did a really big piece of work from the summer into November in reducing current waiting lists in order to progress referrals quicker and requests for service quicker. And I would suggest that the most important thing with regards to those cases awaiting allocation is that you keep us up to date. So any request that comes into us is triaged by the front door. They send you an email saying that they've sent it over to us. Within 72 hours of receiving that email from the front door, you should receive a follow-up email from the area team confirming that they've received your request and what they're doing with that request. They might say it's gone on a waiting list. They might say we're allocating it. They might say you might get immediate contact if it was a high priority from the allocated worker. We would encourage you to keep us up to date if you have any TAF meetings or reviews set for those families. If any new issues arise, please let us know. You can go through to Somerset Direct again and they will redirect you to the right person. But having that consistent number at Somerset Direct is the best way to consistently keep in contact with us. So working with our partners, as I've already touched on consistently, is really important. Understanding the step up and step down protocol for the local authority, which talks about meeting children's needs at the lowest possible level, the implementation of team around the family and team around the child meetings to keep everybody involved and up to date, using the early help assessment as a consistent tool for everybody to use, our partnership working with our family front door and our consultation lines and hearing and sharing information at all times. We also have key links across to a lot of partnership panels and meetings, such as pre-birth tracking, where we monitor children prior to birth that have risks or vulnerabilities and ensure the right services are involved. Out of court panel for those young people with emerging and developing risks around criminality and ASB. Linking in with our partners in the police for community priorities, links with our education, you know, working together with everybody across the voluntary, community and statutory sectors is really important to the effectiveness of our work. And we know from delivering and monitoring our successful outcomes that our most successful outcomes are achieved when the right services from the right people are working together. That's exactly the same internally with our children's social care colleagues in the looked after assessment, safeguarding, CWD teams across the board with adoption, fostering, everybody that we have an interface with. With our internal colleagues, we have weekly transfer and allocation meetings where we talk about specific children, young people and their families. Are their needs being met at the right level at the right time? Do we need consultation, advice, transition? Working really closely with our EDT colleagues, especially out of hours and over the weekend when we're helping to manage and de-escalate those crises and emergencies, and that work across the board with consultation, support, advice and guidance whenever we need it. We thought it would be helpful just to give a quick snapshot of some of the data and demand into our service to sort of give people an understanding of the workflow and the level of engagement that we're sort of trying to manage. So just this year alone, since January, this data was run at the end of September, so the end of the third quarter of the year. We had over 1,500 children open to the service. And of those 1,500, over 1,100 were still open to us, so still receiving active work. And you can see there the breakdown of how they're open in different areas. In addition to those 1,100 children, we have 429 young carers open to the local authority, 390 of which are the responsibility of the Family Intervention Service. In addition to that, we've had 2,106 missing episodes for children, so we're having to do those return home interviews. And currently, to give you a picture, across the 4 areas, there were 80 families awaiting allocation. So in the context of the volume of work that we're dealing with, you can see that the waiting lists are minimal and we're processing through and working those as quickly as we can. In addition to that work, we also thought it'd be helpful to see the impact of the service over the 3 years since we launched in 2020. And just to give you an idea, over 16,000 children have had requests for service into the Family Intervention Service since January 2020, and over 12,000, nearly 13,000 of those, 9,000 actually became episodes, so meant that we worked directly with those families. We offered an intervention to those 9,000 children. We've also, in addition to that, completed over 8,000 pieces of duty work. So that's that out of hours crisis intervention work. And for nearly 5,000 of those children were not even open to the Family Intervention Service. They were open to our wider colleagues. So that's an additional layer of work on top of those young carers and our casework and all of that demand. But what we're really happy about is that of those cases, when we close, over 70% of those are closing with decreased need. 12% of those are stepping up to our statutory acute colleagues for the right service at the right time. And a range of those have ended because of disengagement, relocation, lots of different reasons. Just for note for our partners, there are a number of families and an increasing number of families who are withdrawing consent very early in our intervention, because when we go out, sometimes the things that are recorded on an early help assessment don't correlate with their understanding of why we're involved and what we might offer. For example, a professional might have real worry about domestic abuse, but haven't actually got the family to have that shared understanding that that's the work that needs to happen. So sometimes that can be a barrier to that work and mean that families step away because they didn't realise what we were going to be coming along and talking about, or what might have been written on those assessments. So that real open, honest, informed consent is a really important part of those requests coming into us. And then finally, this is our last slide, just to tell you who the staff are in each area. So if you're on global, and if you're not on global, 9 times out of 10, you've probably had an email from one of us if we work in your area. But these are the contacts if you need them. So Sam is our head of service. It's unlikely that you guys would have an interface with her, but for the east of the county, Karma is the ops manager, and for the west, I'm the ops manager. And if you have any worries or anxieties or feel unclear about something, we're more than happy for you to pop us an email. But those are the names of the area team leaders that obviously you can access when you receive the slide as part of the feedback from today's webinar.